Hello, everyone, and welcome back to our inspirational interview series. I'm Hannah Levin with Heartfelt Wellbeing, and I am here today with Dr. Roanne Houck. And I'm really excited to talk with her today because we're going to be chatting about bone health, which is something that I personally am really interested in. And I know that a lot of you are as well. So welcome, Roanne.
Thank you very much for having me, Hannah. It's a pleasure to be here.
Yay. So I'm going to read your bio and then we'll get started learning more from you. So Roanne Rouse Houck, naturopathic physician. She specializes in optimal health and preventative medicine. Medical interests include naturopathic family medicine, functional endocrinology, allergies, nutrition, post-viral syndrome, sports medicine, and integrative care. Dr. Houck is a graduate of the National College of Naturopathic Medicine, now called the National University of Natural Medicine, and completed her residency in integrated medicine in 2002. She is the founder and CEO of Acclimate Mountain Sport Drink, which she began developing in 2003 and is sold nationwide. She is the owner of Main Street Clinic, past president and current legislative member of the Colorado Association of Naturopathic Doctors. Dr. Houck is a native of Crested Butte, Colorado, and currently lives in Gunnison, where she enjoys sports, dance, organic gardening, music, cooking, and staying active and involved in the outdoors in her community with her husband and their 2 children. So welcome to Inspirational Interviews. And I would love to just start by hearing your story of like how you were drawn to naturopathic medicine and the work that you've cultivated over decades now.
Yeah. Thank you for asking. So I did grow up in Crested Butte and graduated down here. Spent a little bit of time in Boulder, and then attended my undergrad at UC Santa Cruz in California. And just coincidentally, didn't really know what I wanted to do and got an undergrad degree in biology and environmental studies. And then after that, moved back to Colorado and got my EMT and worked as a ski patrol up in Steamboat at the resort, and just got really interested in medicine after doing this wilderness first aid course and wilderness EMT course, and then looked at going to an allopathic or traditional medical program, and ended up taking some classes up at the Rocky Mountain Biological Lab, which is a pretty famous lab north of Crested Butte, where they do quite a bit of research around botany as well as climate change and looking at the weather patterns and different things, and took some plant ecology classes and really loved that. And I actually had never heard of a naturopathic doctor. And while I was there and expressing my interest in botanical medicine, someone mentioned, maybe you'd like to blend your interest in medicine and your interest in botany and be a naturopathic doctor. And a couple of years later, I went to Portland and started that program, which is a 4-year program. And then I did do a 1-year integrated residency after that.
Wow. Yeah. It's always so cool, like how life presents these different opportunities to be like, oh yeah, I'm interested in this and now this. And yeah. So that's really fabulous. So now you've been practicing for quite a while and have learned a lot. I know I learned so much all the time from the clients that I work with. And so let's talk about bone health. And will you just give us an overview of what bone health is and why it's important?
Yeah, so our bones are constantly remodeling, like our body is always remodeling. So we're continuously breaking down bone, and ideally we're building new bone. And for a variety of reasons, environmental, toxicology, toxins in our environment, living a longer, living more years. A lot of women are diagnosed with osteopenia as early as their 30s, which is pre-osteoporosis. And then many women are diagnosed with osteoporosis either perimenopausally, which is often in their 40s, or postmenopausally, which is often in their 50s, mid 50s on. And generally speaking, we're a country of reactive medicine. So we sort of wait until there's a problem and then address it. And so I try to really catch women at a young age. So if women have had stress fractures in their teens, or they're getting a lot of growing pains, or they have celiac disease or digestive problems, or they're on a vegan diet, or any of the things that may restrict the amount of minerals they're either taking in or absorbing, or they're using up a lot of those minerals as athletes, we try to really get ahead of that to help prevent bone loss. So the reactive trying to treat osteoporosis or bone loss is a lot more difficult than catching it on the front end and being preventative.
Mm-hmm. Yeah. Yeah. One thing that I've discovered, and I don't know if this is different in different parts of the country, but in the Southeast, I think it's safe to say that most women are not tested for bone density. And I know there's bone density tests and bone strength tests, but bone density is what's usually used to diagnose osteopenia or osteoporosis. And most women are not tested until they're postmenopausal. And then it's like a shock, right?
Mhm.
Yeah. So what are some of the ways in which people might know? Well, so you mentioned if they've had stress fractures, if they're not eating a diet that's mineral rich enough or has the, I guess specific, I mean, we're so focused on calcium, but there's some other pieces to that too. How might we, are there some signs that we could be like recognize in ourselves? Like there's some likelihood that we might need to support bone health?
Yeah, so generally speaking, if you have a family history of osteoporosis or osteopenia, you're likely going to have similar genetics to your mom or dad. Of course, bone loss is more common in women because we have generally lower testosterone. And even though estrogen is important for building and maintaining bone, testosterone is even stronger.
Mm.
So family history is really important. And like I mentioned, fracture history is really important. So if I see women or men, but typically women of any age, and they've had multiple fractures, then we'll do what's called a DEXA scan or a bone density scan at a much younger age and see if their bones are thinning. Anyone who's had digestive problems like celiac disease, which is gluten intolerance, so that's one way we'll often catch bone loss, is that either they have a fracture and then we figure out that they had celiac disease, or they have celiac disease and then we'll do a bone density scan and realize that they haven't been absorbing their minerals for a long time. So early signs can be, or early things to watch for, petite women, white women, fair women, family history of bone loss, family history of or personal history of multiple fractures, digestive problems, vegan or very restrictive diets, also like really high protein diets, anorexia, bulimia. I also look for vitamin D deficiencies. So pretty much everyone in the Northern Hemisphere should be on a vitamin D3, K2 supplement all winter. Generally speaking, once your shadow is longer than you, you're really not getting much vitamin D from the sun. So like in the early morning, in the middle of the winter, and then in the evening when our shadows are really long, we're generally not getting much vitamin D. People are also just generally covering up more because of the skin cancer risk. So wearing a lot of sunscreens or a lot of clothing. So those are some of the things that I look for. Early menopause, fertility is going down, and some women are not menstruating for as long. They're either athletic and lean and they don't start menstruating until they're 15, and then they might be done at 45. So they've had a shorter duration of estrogen stimulation on the bones. So there's a variety of risk factors that can lead to bone loss. And so generally when I meet with patients, we always talk about diet and exercise, and I always ask about fracture history. And if someone has had an unreasonable number of fractures, then we want to go in and look and see if maybe they do have some bone loss and try to be proactive, because generally speaking, we can build bone until 30 or 40 years old. And then after that, we're just really trying to maintain bone.
Mm-hmm. Yeah, I love that you take into consideration the health of the digestive system. That's so in alignment with Ayurveda, and that we're always looking at that as the seat of anything that is out of balance in the system. So yeah, kudos to you for for recognizing that as an important piece of what you're looking at. Yeah.
Yeah, it's so important with all the health and pathology related things, is if your gut is off and you're not absorbing, so many different things can go wrong. And I'll add that, one of the other things I look at is the skin. So if someone has a lot of bumps on the backs of their arms, if they're getting the keratosis pilaris, that can often be an indication of low fat soluble vitamin absorption, which includes vitamin D. And so that's another way that we can look. And also hair, skin, and nails. If nails are really brittle or really soft, or hair is breaking, or skin is excessively dry. So there's a lot of clues that the body isn't really absorbing what it needs. And so even though we see atrophy or thinning of our nails, of our skin, probably there's thinning of the bone as well.
Yeah. Yeah, we look at those too. So in terms of those things, like we hear all the time, like, are you getting enough calcium? Will you talk to us a little bit about calcium and why maybe that's not the only thing to focus on?
Yeah, so the general recommendation, sort of the generic recommendation, is for women, postmenopausal, perimenopausal women, to get about 1,200 milligrams of calcium a day. And so some women will just take a supplement that's 1,200 milligrams of calcium. The problem is you're exactly right, is that in nature, minerals come in a balance: calcium and magnesium and boron and zinc and all these different things. So I'll start out by asking my patients to use an app. There's a variety of different nutrition apps, and just enter all their food for about 3 to 5 days, and just generally see what their dietary intake of calcium and magnesium and zinc and boron. And I think one thing that people can easily forget is that supplements are designed to be supplemental to what you can't achieve through your diet. So if you realize that you don't drink milk, and you don't do soy, and you don't really eat that many dark leafy greens, and you have a relatively processed food diet or a carbohydrate rich diet, then you may be looking at, you're getting 200 milligrams of calcium a day, in which case supplementing with 1,000 would be great, along with other minerals. But where I started out is have women or my patients estimate their total dietary intake of calcium based on food. And from those food sources, it'll also, again, have those other minerals. And then we can look at supplementation. And then I check vitamin D levels to see where they are. And generally, the recommendation is to have that between 40 and 80 on testing. And most people know now to use vitamin D. And then again, like if a person is really good about getting out in the sun and getting 20 minutes of full arm or full leg once a day, they're probably getting enough vitamin D from the sun if their shadow isn't longer than them. Otherwise, we'll supplement with vitamin D and K2. So vitamin D tells the body to take up calcium, and then vitamin K2 tells the body to put it in the bone, because we don't want to be calcifying breast tissue. We don't want to be calcifying joints. We don't want to be calcifying our arteries. We want to be making strong bone. So generally then we'll pick a supplement that, and for a lot of women, it boils down to something that they can swallow, because a lot of calcium pills are large and they're tablets, and I worry about choking. So it'll be a capsule or even a liquid or a chewable, and I use a mixed calcium. So I know there's a lot of women that are on like an algae-based calcium and different things, but I generally recommend a calcium carbonate, citrate, or some sort of blend, because the carbonate is a little bit higher in elemental calcium, but the citrate's a little bit more absorbable. And I always do calcium with D and K2 and magnesium, and just make sure that everything is balancing out, and that women feel good on it. They're not having digestive problems.
Mm. I love that, yeah, that you're looking at the diet first too, and saying like, what are you getting from your food? And then what does that mean in terms of supplements? That's great. And so talk a little bit about the role of hormones. Then you mentioned testosterone and estrogen both being really important for supporting bone.
Yeah, so generally speaking, after the age of 35, and I'm going to speak primarily to women, because men are a little different with hormones, and they can have bone loss, but typically it's surrounded around steroid use or eating disorders or, other issues. So as far as hormones go, generally after the age of 35, women start having more anovulatory cycles where they don't ovulate and they don't make progesterone as much. And then as you get into your 40s, so that progesterone is dropping, and then estrogen generally starts to drop as well. And estrogen is good for building bone and maintaining bone. And with that drop in estrogen, if a woman has a healthy diet and regular exercise and a good weight, and particularly really good muscle tone, primarily through the core, then those hormones, the cholesterol to pregnenolone to estrogen, testosterone, estrogen will start to decline and testosterone will start to go up. So we all know there's a lot of really strong corporate women and athletic women in their 40s and 50s. As our estrogen goes down, ideally we're just emotionally more even, and that testosterone can create more like motivation and drive and energy, but it's also great for our bone density. But we primarily make that testosterone at night when we're asleep. So as the ovaries start to atrophy, the adrenals take over for the ovaries, and we start to make DHEA and testosterone primarily from the adrenal glands. So when a woman gets a really good night of sleep, so like 8 solid hours, ideally she wakes up with, a full cup of adrenal hormones, which would include testosterone, and that ideally would hold her bone density. Unfortunately, either for stress reasons or abnormal light or other hormonal issues, women can start to really suffer from some sleep disorders. And then we try to get that resolved so we can get their testosterone and DHEA up. If we just can't get it up, then hormone replacement therapy is an option for some women that don't have a strong family history of cancer.
Mm-hmm. Yeah, thank you for explaining that. And that's been part of my evolution. I don't know if I told you this, but I got diagnosed last year with osteopenia. And my mother has severe osteoporosis. My father has now been diagnosed with osteoporosis as well. So I knew that it was something that I probably needed to be aware of well before I got a DEXA scan. And I just requested one because I was like, I want to see what my bones look like well, it was when I was 44. So it's almost 2 years ago now. But the surprise came to learn that I already had quote unquote low bone density. And I thought I was going to be like, oh, well, this will be my baseline. And then post menopause, I'll be like, hopefully no bone loss because I will have done things. I was already doing a lot of things to support my bone. So one of the theories that I have from the Ayurvedic perspective is that bones look different for each constitution. And so when I got this news that was shocking to me that I already had osteopenia, I was like, that is so weird. Like I already do all these things to support my bones. I do have a history of digestive issues, not celiac, but a couple decades of severe constipation and digestive distress, gas, bloating. I also am a white, thin woman. And and 3 out of 4 of my grandparents had osteoporosis too. So this is like something that's in our family, right? We say like, this is the genetics here. So then I started thinking about it in terms of Ayurvedic dosha, like Vata is very thin and light in general. And Pitta is kind of medium, and then Kapha is really heavy. When I was initially in Ayurveda school, I remember my teacher saying, Vadas have bones like a bird. They're very light and airy and porous, and Pittas have kind of medium bones, and then Kapha has bones like concrete.
Mm-hmm.
So then I was like, well, where are the DEXA scan measurements coming from? And I did some research and found out that it's the average bone density of a 30-year-old, right? So that number would be a mixture of Vata, Pitta, and Kapha people, ideally. And then it made me wonder if you're Vata predominant, if we were testing Vata predominant women, especially early in life, would they show up as having it would, a lot of them show up as already having osteopenia. And so I've been kind of like curious about this in terms of dosha, where our Western medical system is more of a one size fits all. We're all getting tested with the same thing. And a lot of people have been, diagnosed or labeled just from the DEXA scan without also having their bone strength tested. And like, I look at somebody like my mother who is diagnosed with severe osteoporosis, who has fallen several times and not broken anything, and she's very active and up and down off the floor and, playing outside and stuff. Let me tell our audience too, Roanne and I are related by marriage. Our siblings are married to each other. So she knows these people that I'm talking about.
Yes.
So anyway, I just think that it's really interesting from that Ayurvedic perspective. And I guess I want to just throw that out there and see what you thought from looking at it through that lens.
Well, yeah, a couple of comments. I mean, I think on the DEXA, you have a T score and a Z score. So one is compared to a 30-year-old woman. And of course, if you're over 30, you're going to probably show some loss. And then a Z score is compared to women your same age. And so it is important. And I always ask about fall history. So when my patients who maybe show some bone loss or have a family history of bone loss or whatever, if they take a fall, like a good fall, like they caught themselves, I document that in their chart. And if they don't break any bones, then I sort of say, well, there went that's maybe your DEXA scan for the next couple of years, because fracture history and fall history is really important. Versus like if someone, twists to put a seatbelt on and they fracture their vertebra, then obviously they've got really weak bones. So you're exactly right that there's what looks like on what things look like on a DEXA and the interpretation of that. And then you can have thin, strong bones, and you can also have thick, weak bones. So fracture history is really important. And then absolutely with our constitutions, and generally speaking, Vata with the bird-like skeleton, we would think of them as having more fractures, and Kapha is not as many fractures. But again, like when I look at bone health, I look at the totality. So the things that are really important are how many minerals and how nutrient dense is your diet? And then how well do you absorb? Are your stools brown and formed and easy to pass and not more than 3 a day? And is your transit time, within a reasonable amount of time? Like, I don't like people to have a transit time less than 9 hours, right? Everything's just washing through. And then how athletic are you? So how much are you burning up? And then also, what's your body constitution like? If you have a lot of muscle mass, you're probably going to have higher testosterone. If you hold weight through the middle, you're probably going to have more estrogen. And if you're just thin all the way around, your hormones are probably going to generally be lower all the way around. So it is, when looking at bone health, I think, unfortunately, in many clinics, a woman does a DEXA. Compared to a 30-year-old woman, she has bone loss, and it's immediately to the pharmaceuticals and calcium. But I guess what I would really like your audience to know is there's so many steps in between, and that is looking at nutrient dense diet. How well are you absorbing? Are you doing things that dump calcium? Like, do you not sleep enough? Do you drink a lot of coffee? Do you drink soda? Do you eat too much protein? Those are things that can cause your body to lose calcium. And then vitamin D and your vitamin K. And then again, like your sleep and activity, and including both weight-bearing exercise like Zumba or walking, but also, challenging your muscles either with push-ups or plank or with weights. And so bone health is about the totality of things, and women can have a lower DEXA like your mom and really almost no fracture history. And so I would say, your mom, even though she has thin bones, she probably has really strong bones.
Yeah. Yeah. And she's good about, she like puts on her little backpack full of heavy objects and hikes up the mountain every day. You know what I mean?
Yep.
She's such a good patient. Talk a little bit, I know we're almost out of time here. I would love to hear you talk a little bit about protein, because you just mentioned having too much protein can pull calcium. And that is something that is such an important conversation because so many people are focused on more and more and more protein. And I get asked this all the time. Like, I need more protein, I need more protein. How do I get more protein? I'm like, I don't think that's the conversation. But yeah, can you talk a little bit about how too much protein can be a problem?
Yeah, I get asked that all the time too. And the problem is particularly around animal protein because it's so acidic. So your body will dump minerals to neutralize that acidity. And so you really want a much more alkalinizing diet. And so really a Mediterranean style or an Ayurvedic diet that is really rich in plant-based foods and lots of colors and lots of dark leafy greens. And I'm actually a big fan of non-GMO organic soy. I think it can be really beneficial for women, and particularly constitutions that are warmer because soy is a cooling food. But basically, you know, a primarily plant-based diet. And I think another thing that people forget is that plant-based foods actually have a lot of bioavailable protein. And so you know, when you add up your protein and you're eating like legumes and you're having nuts and seeds and you're eating dark leafy greens and all of those things, and if you throw in some soy, I mean, all of a sudden you're getting, you know, 20 grams of protein per meal. And I think that generally is sufficient. I know I have patients that want to get in, you know, 100 or 150 grams of protein a day, but your kidneys have to clear that, your body has to deal with that. I mean, that's just a lot of protein, particularly if a lot of it's coming from animal protein.
Yeah. Yeah. Awesome. Great to have that perspective there. Yeah. I'm like, there's protein in lots of things that you don't think of as having protein. You
Yeah,
just have
yeah.
to eat more quantity to get that same amount. Well, awesome. The the steps that we might take. So if for folks that are watching this, what would you recommend in terms of, like, let's say for somebody who's perimenopausal and then postmenopausal right now in terms of connecting with their own bone health? Would it be to, like, go out and get a DEXA scan, or like?
It's a great place to start. I mean, number one, if you have a strong fracture history, it would be worth just getting a baseline DEXA. And anymore with the way that labs and imaging are going, you can typically go into almost any imaging facility and request, you can just pay for labs and you can just get your own DEXA scan. And they're generally around $150. A vitamin D level is around $50. It's really simple to do. A metabolic panel that looks at your electrolytes and your calcium is probably like $50. So you can go in and you can start your own journey by, you know, just getting some very basic blood work, including a D, and getting a DEXA scan, and then looking at your fracture history. And then I have a handout that I give to patients. I kind of have this in front of me. So dietary recommendations, you start out with estimating your calcium intake based on your diet. And again, you can use an app. And then the other minerals will kind of fall into an alignment. Weight-bearing exercise, you want to be, I tell my patients, try to be active 60 minutes a day. And that to some people is like, whoa, a lot, but you can count walking to and from the store, walking up and down your stairs, walking way out to get the mail. Anywhere that you can throw in walking or taking the stairs can count. And then just implementing some really basic weights. You can get some light weights, 5-pound weights, or you can just use cans of food, you know, and just challenge your muscles a little bit, particularly in the upper extremities, because these are not as weight bearing. And then there's really basic labs. Like if you do show bone loss, checking your thyroid and checking for celiac, and just a basic panel that any doctor can help you get. And then looking at calcium. So generally you want to be around 1,200 milligrams total calcium intake a day, and that's your food and that's your supplement. And then magnesium is usually 1-to-1 or at least half of that amount. And magnesium is in dark food. So dark legumes, dark leafy greens, dark chocolate, like dark things like that. And then you want to optimize your vitamin D, and that really depends on sunlight, fortified foods, what part of the country you live in, how much you cover up. And so it's really good to invest in a vitamin D level. And you don't want to take any vitamins or minerals within 12 hours of testing. So you want to get a really good baseline. And then from there, just, you know, figure out, do you have bone loss? It's pretty much the same for pre peri and postmenopausal women. The biggest difference with postmenopausal women or peri is that you may be a candidate for a small amount of bioidentical hormone replacement therapy, which can be really good for your skin and your brain and your bones, but you'd want to do that with a provider just to make sure that you don't overshoot things and end up with side effects or stimulate any sort of cancer growth.
Awesome. Thank you so much. So for folks watching this, if they're interested in working with you, you do telehealth, right?
I do some telehealth. Yeah. So, yep, my clinic is called the Main Street Clinic and we're in Gunnison. And yeah, I always like to
Awesome.
see people in person, but I am happy
Yeah.
to do telehealth.
So if you live in Colorado and want to make the trip to go see Dr. Houck, come on over to Gunnison. Otherwise, you could reach out for a in-person connection. Well, thank you so much for taking some time out of your lunch break today to do this. Is there anything you'd like to say in closing?
No, not much to add other than just, I think as mothers, just passing this information on to our daughters and our sisters, because like with anything, prevention is so much better than reactive treatment if possible.
Yes, amen to that. Well, thank you so much. Really grateful for your time.
Yeah, thanks for having me. Absolutely. I hope everyone has a great day or a great evening.
Yes, awesome. Thanks so much.